Good day everyone, I am Michael, moderator for this webinar. I welcome everyone for today's webinar, which is Legal and Ethical Challenges for Employers, an Increase in Burnout, Stress and Mental Illness. I would now like to introduce our presenter for today, Dr. Susan Strauss. Dr. Susan Strauss is a national and international consultant, speaker, and trainer in organizational effectiveness and management development. Susan has her doctorate in organizational leadership and master's degree in community health and is a former RN. Now I would like to hand over the floor to the speaker. Over to you, Susan.
Well, thank you very much, and greetings, everybody. I hope you're having a good day. So we're going to be talking about an area that's becoming more and more important. Excuse me. First of all, it's more of an issue generally in our society. And when it's an issue in our society, it is an issue for the workplace as well. So let's get started and let's look at the objectives for today. We're going to differentiate between mental health and mental illness. We'll discuss some of the most frequent mental health conditions with an emphasis on depression and anxiety and the different personality or disorders. We'll identify the demographic groups that are most at risk for mental health issues, and we'll examine the myths of mental illness, of which there are many. We'll list some of the signs of possible mental health issues that you might want to recognize in your workplace. We'll outline U.S. mental illness statistics, and we'll explain mental illness as an ADA, or American Disabilities Act, protected disability. We'll describe what's called the interactive process that's required that you do for somebody that you suspect has mental illness, somebody that has come out to you as having a mental illness, or someone that you can see visually that has not a mental illness so much as, some other kind of disability as well. And we'll explore the accommodations required by the ADA. We'll examine your role in creating a healthy work environment. And how do you combat negative stigma of mental illness in the workplace? So with that, let's go. To generate a culture of well-being. So what is mental health? Well, it's a state of well-being. And this is what we need to think of, in which you and everyone you work with are able to realize what your full potential is. When you've got good mental health, you're able to deal with normal stressors of life, and you can produce productively, fruitfully. You are able to make a contribution to your community. So what about mental health as a spectrum? So when we think about that, it is that none of us is mentally healthy all of the time. So let's look at some of these mental health issues at work, because we've got a bunch of them. Stress, depression. Now we also have the use of alcohol, tobacco, of course, marijuana, and then prescription drugs, and then gambling. We've got people that are addicted to gambling. So these are mental health issues that can demonstrate themselves in a number of ways. What about eating disorders? So mental illness then, it's a condition where an individual has their thinking and their feeling and their mood altered. It can affect someone's ability to relate to other people. That might mean people at home. That might mean friends, family, and people at work. Depression is a physical, developmental, and psychosocial illness. What are signs of mental health in the workplace? Let's look at some more. If you've got people that are mentally ill, those that he or she works with may feel that they're walking on eggshells. So what are some of the signs and symptoms? Now, these are generally speaking. And then something called presenteeism. So in the United States, there's about 18% or more than 41 million Americans that have a mental illness. Less stress, which is a big one, in your workplace. According to global statistics, depression is the second leading cause of disability. What are some of the myths regarding mental illness? So you're wallowing, so to speak, in self-pity. Now let's take a look at anxiety disorders. And they're all characterized by fear and apprehension. So it's not just, oh, you're anxious. What kind of anxiety? Well, let's take a look at all the different kinds of anxiety. Those are the first three. The cause is biological and the environment. There are 42 million people at any current year. So let's take a look at some of the symptoms of anxiety. So consequently, yeah, people are going to sweat and tremble and have an upset stomach. But if you've got the anxiety disorder as a mental illness, these three symptoms are with you pretty much nonstop. So let's look at anxiety at work. Job productivity would drop. It doubles the risk of poor performance. What about personality disorders? So a personality disorder is, again, the traits and habits, but they are inflexible and they are damaging when you have a personality disorder. Usually with a therapist, that's one of the treatments that they use. So let's look, though, at the types of personality disorders. So let's look at a couple of these. Okay, let's look at OCD. This isn't one that begins in adulthood. It's one that begins in early childhood. Now, what will you see in the workplace? And it's important to think about this as a disease. Now, a histrionic personality disorder. So the antisocial personality disorder. People are not always aware of what is going on here. I don't feel good about coming to work anymore. I don't know exactly what's going on. Now, there's the paranoid personality disorder. That is going to lead to adversarial relationships. Now, what about dealing with them in the workplace? You can give the feedback to this person in a reassuring way. So, borderline personality disorder. And they will need specific suggestions for improvement. Now, the narcissistic personality disorder, but they can do fairly well because they are charming and smart. You tell them the difficult and you end with the positive. I think that's the way it goes. So this is how you would deal with it in the workplace. Now, passive-aggressive personality disorder. So we then are aware of how subtle our aggression can be. Others are aware of it much more than we are. What about this person in the workplace? Well, they're difficult to manage. There again, everybody's smiling and looking happy. And there's that one person saying, I don't think so. And away they go. So let's look at depression. Remember, the most common in the United States. And postpartum depression. After giving birth, we have postpartum depression. 200 million lost workdays in the U.S. annually due to depression. Now, there's clinical depression, and that's what's also known as major depression. Now, there's something called dysthymia, and that is a depressed mood that lasts 2 years or longer with less severe symptoms. Now, here are the signs and symptoms of depression. Now, might we get certain times in life where we feel some of these? We might. Now, the causes of depression are the same for almost all of them, where the depression causes changes in both the anatomy and the physiology. Now, sometimes we'll hear of a mother who's killed her baby, and we think, what in the world? This is psychotic depression. It is severe depression It includes psychosis. Suicide. We know that this can occur. About 800,000 people die of suicide a year. It's more common in men that come from higher income countries. It's more common in women in lower and middle income families. You want to create a stigma-free workplace. How do you do that? You educate, educate, educate. And then you might want to consult with your EAP, Employee Assistance Program. Those people are usually psychologists. I haven't seen any psychiatrists, but they can be used in doing some training. So the workplace culture and stress. So what is disability under the ADA? And hopefully you've had some of this recently. So what's a physical impairment and a mental impairment? Learning disabilities. These are just examples that are given. And think about the major life activities. Now, these are examples of a reasonable accommodation that you can offer people. So what do employers need to do? You have to have ADA accommodation policies. Training needs to go to all employees. So mental wellness matters. And this is why diversity, acceptance, and respect. These are the strategies that I've talked about that you need to put into your workplace. Use these. They should be part of your strategic plan. And these are best practices. You begin with the C-suite. You survey your employees. You recognize the interface between physical and mental health, and you create a wellness program. Now, I'm giving you this as well as just a handout. This is the guidance from the EEOC. And you can read this, but this is what they say that employees should be asking you, and you need to be able to give the answers. So these are the recommended practices, and you want to be sure that you think about these and use these in your strategic plan. I've given you some handouts to use, and that's it. It's a long webinar, isn't it? Thank you. First of all, I want to thank all of you for joining us today. I hope that it was beneficial and that you learned some new knowledge and skill. In the meantime, I wish you well, be safe, and thanks for joining us. I hope to see you again, and thank you, Jonathan, as well.
Thank you again, Susan, for the great presentations. So that does conclude the session for today. Thank you everyone for participating. You may all disconnect now. Have a great day ahead. Bye-bye.